H1N1 and the seasonal flu are at the tops of most parents' minds, but it's also a time of year when children can come down with colds, fevers, and ear infections. And parents of newborns may have an especially hard time recognizing when their baby is sick. Joining us now to discuss is Kate Kelly, managing editor of American Baby Magazine. Good morning.
Good morning.
That can be a scary thing. You see your child getting sick. What are some of the bigger things that parents are dealing with?
Well, parents always freak out at fever. It just seems scary, and if the number seems high, they just are concerned. And whenever you have an infant, which we consider under 3 months, you should call at any sign of fever. You know, take a rectal temperature, call the doctor with any fever. Chances are it's nothing to worry about, but they always want to check out an infant. If it's an older child with a fever, it's 101 for a kid up to age 1, and then it can go a little higher before you get nervous, like 102 for up to 4, and then 104 for 4-year-olds and up. But it's not really the fever itself that you should be worried about. It's what's the underlying condition that's causing this fever. And you should go more after the infant, where any fever is a warrant to call. It's more their behavior. Okay. If they're lethargic, if they're cranky, if they're just not their self, that's more worrisome, really, than a fever.
And so what about fluids, drinking fluids, or bathing? Well, sometimes we hear those kind of advice.
You can do infant Tylenol, although, again, your doctor should be consulted if the baby's under 3 months. And after that, infant Tylenol really helps bring down a fever. Lots of fluids. If they're still nursing or on formula, they can have that. If they're older, they can have just water. And then bathing in a tepid water can help bring a fever down and make them more comfortable.
The common cold.
Yeah.
We know when we have it, well, most of the times, but for a baby, that can be a little hard to detect.
Yeah, well, you know, if your baby's miserable, they can't really tell you why, so that can be frustrating. You know, you may notice a sniffly nose or just cranky behavior. Again, they may have a little bit of a fever when they have a common cold. And again, if it's an infant under 3 months, you should just call the doctor if you suspect anything. But for older kids, it's just going to run its course, and you can try and make them comfortable. Again, Tylenol, you know, sometimes they have a hard time sleeping at night because their sinuses are all stuffy. So if they have their head raised a little, that can make them more comfortable and drain the sinuses. But usually a cold is just going to run its course.
Some of those electrolyte drinks are recommended. Are those good to
those electrolyte drinks can replace some of the minerals lost when you get dehydrated. So if your child for some reason isn't drinking, then you might want to give them an electrolyte solution.
The flu. We've been hearing about vaccines and whatnot. Should you be taking advantage of those?
Yeah, if your baby's 6 months or older, they're definitely recommending getting the vaccine. And they have 2 vaccines. They have the regular run-of-the-mill flu vaccine and the swine flu vaccine. And you know, it's just calling your doctor and seeing what he or she wants to do about getting one or both. But definitely get the flu vaccine, and you should get one too.
And what about lastly, ear infections? We sometimes see the children holding their ears.
I know ear infections are tough because you really, you know, oftentimes you really don't know. The only way they can really be diagnosed is if a doctor looks in the ear. But you can suspect an ear infection if the kid's tugging his ear, he has a cold. Often a cold turns into an ear infection. He's really cranky at night. If it shows up at night when the cranky behavior starts, it could be just that it hurts more lying flat. So again, infant Tylenol. If you go to, you should go to the doctor. They may prescribe an antibiotic, which will help, and you know, just rest. It'll go away.
All right, great advice, and perfect for this season. Kate Kelly, managing editor at American Baby Magazine. Thanks for being with us. And for more on this and other great articles from American Baby Magazine, just go to our website, cbsnews.com, and click on American Baby.